this is like
We started with bite just on this one side, not terribly unusual when we do double arches. Bite down for me. Now you can see I'm holding there, open up, and we are bite down, holding here. So I just want to get good double-sided contacts, and then we'll self-adjust into this a little bit. Open up for me. An implant that we placed and took the impression of 4 to 6 months ago. Bite down, tap, 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 grind around, chew like you're chewing gum. Open. That's a Teflon tape. God, you're so close, Caroline. We have a patient that we did a hybrid on, and he's in a surgery temp, and now we're ready to go to the final. So I'm going to walk you guys through how we're doing that here in the practice. Start with a digital impression of the teeth in the mouth. We're trying to get some soft tissue landmarks for the lab. Stay biting. Stay biting. Be careful. This implant, so to avoid any potential confusion in the lab, we're going to go ahead and cut this scan post off of here, scan body off of here. I'm going to verify that this seats back in the mouth correctly, and It does, nice and passive. So that's perfect. Open it. Okay.
Sorry.
We put that surgical tent back in. While it's out of the mouth, obviously give it a good cleansing. Okay. Very deep access holes with the Teflon. I like to put some Teflon in there so that we don't get stuck in any potential undercuts. Masha likes to start on her side, so I start on my side just to irritate her.
So kind.
Open it. Okay.
Sorry.
We put that surgical tent back in. While it's out of the mouth, obviously give it a good cleansing. Okay. Very deep access holes with the Teflon. I like to put some Teflon in there so that we don't get stuck in any potential undercuts. Masha likes to start on her side, so I start on my side just to irritate her.
So kind.
All right, so that's a patient that we did a surgery on maybe 4 months ago. We're taking his final impression. That part's pretty straightforward. But he on his own brought up adding the implants. I had begged him almost to do it while I was doing the upper surgery, but he wasn't ready. And that's usually that's a great example of communication and trust and waiting with patients and not pushing them too hard. Now he's ready to do it. So we're going to put the plan together. He asked me when he can do it. I said, when you're ready. He says, well, I'm ready. I go, great. Here's what I would like to do. I want to deliver your final upper. I'll take new records at that point so I know exactly how many teeth we have, how we're going to set everything on the bottom, and then we'll do the surgery. And I've transferred that to Masha's in charge of making sure that we get him scheduled to deliver his final. Megan, my treatment coordinator, is in charge of making sure we put together the plan for implant site 19, 20, and 29. And then pretty much we're good to go from there.